Hi, my name's Lisa Foley and I'm a nurse practitioner at North Mississippi Medical Center in Cardiovascular Services. To kick off Heart Month, we wanted to start off by talking about women and heart disease. The term heart disease refers to several types of heart conditions, including coronary artery disease and myocardial infarction or heart attack. Although heart disease sometimes is thought of as a man's disease, almost as many women as men die each year of heart disease in the United States. It is the #1 cause of death. Despite increases in awareness over the past decades, only about half of women recognize that heart disease is their #1 killer. Heart disease is the leading cause of death for women in the United States, killing over 300,000 women in 2020, or about 1 in every 5 female deaths. Cardiovascular disease accounts for about 1/3 of all female deaths and half of the deaths in Mississippi. We all love Mississippi, and we think Mississippi ranks #1 in hospitality and generosity, but unfortunately also Mississippi ranks #1 in death rates due to heart disease mortality. Women with heart attacks are more likely to have complications and increased mortality. They are 20% more likely to develop heart failure or die within 5 years of an MI or heart attack. Women are more likely to wait before presenting for medical attention, which delays the care that they need. So what are the symptoms of heart disease? Some women can actually present with no symptoms. In fact, a recent study of 450 women showed that only 43% of those women actually presented with heart pain or angina. Angina is a dull or heavy ache or a sharp pain that people will present, and they have it in their chest. It can be in their abdomen, it can be in their back or upper shoulders. Also, it can present in the neck, the jaw, the throat, or even the teeth. These symptoms can happen when you're resting or when you're going about your daily activities. Other symptoms that women can have that might indicate a heart attack is nausea, vomiting, fatigue, shortness of breath, diaphoresis or sweating, and dizziness. Sometimes heart disease can be silent and not diagnosed until you actually present with an emergency, like a heart attack. It could also be presented as an arrhythmia. An arrhythmia may be presented as a fluttering sensation in your chest. And lastly, you could present with congestive heart failure. Signs of heart failure is shortness of breath, fatigue, or swelling of the feet, ankles, legs, abdomen, or neck. If you have any of these symptoms, call 911 right away. So what are some of the risk factors of heart disease? High blood pressure, high bad cholesterol or LDL cholesterol, and smoking are key risk factors for heart disease. About half of all people in the United States have at least one of these 3 risk factors. Smoking, even minimal use, increases your risk of heart disease 6-fold. Several other medical conditions and lifestyle choices can also put people at a higher risk for heart disease, including diabetes, family history, having obesity or being overweight, eating an unhealthy diet, being physically inactive, or drinking too much alcohol. If you have these risk factors, how can you reduce your risk of heart disease? To lower your chances, one of the most important things to know is to know what your blood pressure is. Having uncontrolled blood pressure can lead to heart disease. High blood pressure can have no symptoms, so it's important to have your blood pressure checked regularly. And remember that a normal blood pressure is less than 120/80. You need to talk to your doctor or healthcare team about whether you should be tested for diabetes. Having uncontrolled diabetes can raise your risk of a heart attack. If you have diabetes, your 3-month blood sugar average, or A1C, should be maintained at less than 6.5%. One of the most important is if you smoke, quit smoking. If you don't smoke, don't start. Discuss checking also your blood cholesterol and your triglycerides. The guidelines for cholesterol levels if you have known coronary artery disease is now to dose with a moderate to a high-intensity statin, and there are only 2 recommended medications by the American College of Cardiology. Those medications are rosuvastatin and atorvastatin. So it's no longer about treating a certain number, but it's about the dose of medication that you take if you have known heart disease. We give these medications to help reduce or stabilize plaque formations that may be in your artery. If you do not have coronary artery disease, you should check with your doctor about the ASCVD risk calculator. This is a tool that he can use where he would enter information such as your sex, your diabetes risk, your LDL cholesterol, do you smoke? All of these things are entered into the risk calculator, and it will let them know if you are more at risk. If your risk calculator score is greater than 7.5%, a statin may be indicated for you. Exercise is one of the most important things that you can do to lower your risk. It's no longer, though, 30 minutes a day, 3 days a week, but now it's 50 to 60 minutes on most days a week. You need to keep your weight normal. Your BMI should be less than 25, and your waist circumference should be maintained at less than 35 inches. You should make healthy food choices, and you should limit how much alcohol you drink to 1 drink per day. Manage stress levels by finding healthy ways to cope with stress. Finally, know that screening programs are available. A calcium score is a great screening tool that's available to everyone. A cardiac CT calcium score is a quick, convenient, and non-invasive way of evaluating the amount of calcified plaque in your heart vessels. The level of calcium equates to the extent of the plaque buildup in your arteries, and it's the plaque in your arteries that can cause heart attacks. So for the month of February, Cardiology Associates is teaming up with North Mississippi Medical Center by offering a CT calcium score for a special rate. Beginning February 1st, you can call 662-620-6800 to get your calcium score scheduled. Remember that heart disease can be prevented. Early detection and treatment is key to limiting your risk. Do not delay, and don't think it won't happen to you. Following a heart-healthy lifestyle doesn't have to be complicated, and it doesn't mean you need to live a life of self-deprivation. Instead, find ways to incorporate heart-healthy habits into your lifestyle, and you may enjoy a healthier life for years to come.